Hi, my name is Nolan Christensen, and I was in a group with Sarah and Austin. And today I'll be talking to you about a condition you have called vasculitis. And so by the end of this, I hope you get a good overview of it and what that looks like for you going down the road. So an overview of vasculitis, it's inflammation of the blood vessels. The early diagnosis for this is key because vasculitis can worsen very quickly. And so with this, blood vessels become narrowed, closed off. They can become stretched or they may bulge, and when they bulge, that's called an aneurysm. And when that aneurysm bursts, that can cause internal bleeding, which would be a very big problem. And so some more facts about vasculitis. It's quite rare as it's less than 200,000 cases per year in the US. The condition itself cannot be cured, but it can be managed. Symptoms depend on which organs or areas are affected, and cases range from mild to life-threatening. And so for vasculitis, there are actually up to 20 types of this, and it's grouped based on blood vessels affected. So you have like small vasculitis, medium, large, and so on. So for symptoms and assessment, there's general signs and symptoms that you may be experiencing. This would include fever, headache, fatigue, weight loss, general aches and pains. Then there are also symptoms that are related to the body parts that are affected. So for our digestive system, you may experience pain after eating, ulcers and preparations. For the ears, it would include ringing in the ears, loss of hearing, dizziness. For your eyes, they may look red, be itchy and burn. You may experience double vision and potentially temporary or even permanent vision loss. So for hands and feet, you would experience numbness, maybe a weakness there, or the soles and palms may become swollen and even hard. And with the lungs and respiratory system, you could experience shortness of breath, and even potentially you could be coughing up blood with this. And then for skins, you may see lumps or open sores. Some risk factors for vasculitis would include your age, family history, lifestyle choices, medications, infections, immune disorders, and sex. But the thing about this though, it all depends on the type that you have. So for some types, it's more common in younger and in women, and in other types on the other side of the spectrum, it'd be more common in men and then when you're older as well. So for some causes for this, the exact cause is unknown, but some types are related to genetics and others result from the immune system attacking the blood vessel cells. And so possible triggers include hepatitis B or C infections, blood cancers, immune system diseases such as lupus or rheumatoid arthritis, and then reactions to certain drugs. So for your diagnosis for this, it would begin with a doctor taking note of medical history, performing a physical exam, and then after that, he would perform some tests. He or she, would perform tests such as a blood test, imaging test, angiography, or biopsy. And an angiography, that's basically an X-ray for your blood vessels. And taking all these tests are essential because it helps rule out other conditions that may mimic vasculitis and its symptoms. So treatment for vasculitis, this would include medications such as corticosteroids, surgery for aneurysms, or also to help repair and restore flow to blood vessels that were clogged or blocked. And then immune system medications such as cytotoxic drugs. And with the corticosteroids, these are used to help control inflammation. However, they can have very severe side effects, especially if taken for a long time. And so some of those side effects would include weight gain, diabetes, or weakened bones. So for the prognosis and follow-up for this, big thing is the side effects. For many people dealing with the side effects from the medications that you may be taking, these often are the most difficult part of having vasculitis. So with that, it's important to have a good support system to help you through this. Healthy diet is also essential, and along with exercises to keep you as healthy as possible. Checkups are also important to stay up to date with the symptoms you may be having, because a big concern is those aneurysms, and if they burst, then that can be a big problem there. This was once considered a fatal disease, but it's become much more manageable with treatment, and it's just important that you take the steps necessary to keep yourself healthy. And here are some of the resources I used here, and if you have any questions, I'd be happy to help, or you can look up yourself to get more information.